Welcome to today's session. We're diving deep into some of the most frequently asked questions about heart health, the kind of concerns many people carry silently, unsure if they're serious or just part of getting older. Let's explore them together, one by one. A common question I hear is this: I've heard that if I'm not getting any sharp pain or heartburn, my heart is fine. Is it true that heart attacks always start with strong chest pain? This is one of the most dangerous misunderstandings. Not all heart attacks arrive with dramatic, crushing pain. In fact, many people, especially seniors, women, and those with diabetes, may experience what's known as a silent heart attack. Instead of sharp pain, they might just feel unusually tired, mildly nauseous, lightheaded, or notice discomfort that comes and goes in the chest, back, or even throat. The absence of pain doesn't mean the heart is fine. Subtle symptoms can still signal serious trouble, and the earlier you check, the better. That leads us to another question patients often ask. If someone had a heart attack without realizing it, would there be any signs afterward? The answer is yes. The body often gives clues, even after a silent episode. You might feel more easily exhausted, short of breath during everyday activities, or sense that your stamina just isn't what it used to be. Sometimes people only discover it during a routine test like an ECG, which shows past heart damage they didn't know about. That's why regular screening becomes more important with age, or if you live with risk factors like high blood pressure, diabetes, or a family history of heart disease. The heart doesn't always shout. Sometimes it just whispers. We have to learn to listen. And here's a powerful question that gives many people hope. Is it true that once you have a heart problem, you can never fully recover? Or can the heart heal over time? While it's true that some damage, like from a major heart attack, can't be fully undone, the heart is far more adaptable than people think. With consistent care, including the right diet, exercise, medication, and stress reduction, many heart conditions can stabilize or even improve. In fact, studies show that early-stage heart disease can sometimes be reversed through lifestyle changes alone. It's not about perfection, it's about persistence. A healthier heart is always possible, no matter where you're starting from. Let's continue with more important and commonly asked questions about the heart. Questions that often come up during regular checkups or quiet concerns people carry without voicing them. One I hear often is, can stress alone cause heart problems, even if all my test results are normal? Yes, stress by itself can significantly affect your heart, even when your blood pressure, sugar, and cholesterol are all in the normal range. When you're under stress, your body produces more cortisol and adrenaline. These hormones can raise your blood pressure, increase inflammation, and cause blood vessels to tighten. Chronic stress can damage the inner lining of your arteries, making it easier for plaque to build up. And that increases your risk for heart attacks and strokes. Even without physical symptoms, the emotional load we carry can silently wear down the heart. That's why managing stress isn't just about mental peace. It's a direct investment in your heart's health. Another question that follows is this: I don't feel stressed, but I do get angry or irritated quickly. Is that the same thing? That's a very insightful question, and the answer is yes. In many ways, it's the same. Anger, impatience, and irritability are all signs of an activated stress response. When you get angry often, your heart rate spikes, blood pressure rises, and blood vessels constrict. Over time, this puts a serious burden on your cardiovascular system. Studies have shown that people with uncontrolled anger or hostility have a higher risk of heart disease, even if they seem otherwise healthy. So learning to pause, breathe, and manage emotional reactions isn't just good for relationships, it's protective for your heart. Let's address one more concern that people often believe is truth. I heard that drinking a glass of wine every day is good for the heart. Is that real science or just a popular myth? This belief became popular due to studies about red wine and heart health. But the truth is more complex. While red wine does contain antioxidants like resveratrol, which may have heart benefits, the risks of daily alcohol often outweigh the rewards. Even moderate alcohol can raise blood pressure, affect heart rhythm, and strain the liver. For seniors especially, it may interfere with medications or increase the risk of falls and memory issues. So no, drinking wine daily is not a heart-healthy habit. There are far better and safer ways to support your heart, like a Mediterranean-style diet, regular walking, and staying emotionally connected. A very common one is, sometimes I feel my heart skip a beat or flutter for a few seconds, especially at night. Should I be worried about that? This sensation is known as a palpitation, and while it's often harmless, it can sometimes signal an underlying issue. Occasional fluttering or skipped beats can happen due to anxiety, dehydration, caffeine, or even lack of sleep. But if it's happening frequently, lasting longer, or accompanied by dizziness, shortness of breath, or chest discomfort, it could point to arrhythmia, an irregular heart rhythm. It's best not to ignore this. A simple ECG or Holter monitor test can help determine if your heart rhythm is safe or needs treatment. Remember, the earlier we check, the more peace of mind you'll have, or the sooner we can intervene if needed. That brings up a related question. Can drinking too much tea or coffee really trigger heart palpitations? Yes, in some people, especially those sensitive to caffeine, tea, or coffee can definitely trigger palpitations. Caffeine is a stimulant. It increases alertness, but it can also speed up your heart rate and cause irregular beats in some individuals. If you notice fluttering after your third cup of tea or coffee, your body is trying to tell you something. Cutting back gradually and drinking more water throughout the day can help regulate your rhythm. Everyone's tolerance is different, but moderation is key when it comes to stimulants in your heart. And here's one more doubt that people are often unsure about. If I walk every day for 20 minutes, is that enough exercise to keep my heart healthy? The good news is, yes, walking for 20 minutes a day is a fantastic place to start, especially for seniors. It improves circulation, strengthens the heart muscle, lowers blood pressure, and supports mood and metabolism. That said, over time, you may want to gently increase the duration or intensity if you're able, like aiming for 30 minutes or adding a small incline. Even light movement like slow stretching or climbing stairs can count. The key is consistency. Your heart doesn't need extreme workouts, and it just needs regular reminders that you care. One question that often comes up is this: can sleeping on the left side put pressure on the heart and cause problems? This is a question surrounded by a lot of confusion, and the short answer is no. Sleeping on your left side doesn't harm your heart in healthy individuals. The heart does lean slightly toward the left, so some people with heart conditions may feel their heart beat more when lying on that side. But for most people, it's completely safe. In fact, sleeping on the left can even help digestion and reduce acid reflux. If you're someone with heart failure or breathing problems, your doctor might recommend a specific sleep position, but otherwise, choose the one that helps you sleep best. Comfort matters more than left or right when it comes to heart health. Another related concern I hear is, sometimes I wake up with a racing heartbeat. What causes that, and should I be alarmed? Waking up with a racing heart can be caused by several things, most of them not dangerous. It could be related to vivid dreams, anxiety, low blood sugar, dehydration, or even sleeping in a warm room. However, if it happens regularly, or if it comes with chest tightness or sweating, you should definitely get it evaluated. It may be a form of nighttime arrhythmia or an early sign of other heart rhythm disturbances. Keeping a sleep log, drinking water before bed, and limiting stimulants like sugar or caffeine in the evening can often help. And here's one more that many people quietly wonder. Does taking a daily aspirin prevent heart attacks? And should everyone over 50 take it? This was a common recommendation in the past, but recent research has changed our approach. Daily aspirin is now recommended only for people who have already had a heart attack or stroke, or who have very high risk based on their medical history. For healthy adults with no history of heart disease, the risks of daily aspirin, especially bleeding, may outweigh the benefits. So no, not everyone over 50 should automatically take aspirin. It's a decision that needs to be personalized by your doctor based on your blood pressure, cholesterol, diabetes, and other risk factors. One question that surprises many is, can gum disease or poor dental hygiene really increase the risk of heart problems? Yes, and it's not just a small connection. Gum disease or chronic inflammation in the mouth has been closely linked to heart disease. The bacteria involved in gum infections can enter the bloodstream, triggering inflammation in the blood vessels and contributing to plaque buildup in the arteries. This means something as simple as brushing, flossing, and regular dental checkups can actually protect your heart. Your mouth is connected to your whole body, especially your heart. Taking care of it isn't just cosmetic, it's cardiology too. Another concern people have is this. My blood pressure is normal at the doctor's office, but high when I check it at home. Which one is accurate? This is a classic case of what's called masked hypertension, or sometimes the opposite, white coat hypertension. If your blood pressure is consistently high at home, but normal in the clinic, the home readings may actually be more accurate. Why? Because they reflect your day-to-day state without the artificial calm of the doctor's office. If this is happening to you, track your readings at the same time daily, sitting calmly, feet on the floor, after resting for 5 minutes. These readings can help your doctor get a clearer picture and decide whether treatment is really needed. And finally, one powerful question that deserves clarity. Is it possible to live a long life with heart disease? Or does diagnosis mean my life will be shortened? Being diagnosed with heart disease doesn't mean your life is over. Far from it. In fact, many people live long, full, active lives with proper management. The key is consistency, taking your medications, eating wisely, exercising gently, reducing stress, and staying connected to your care team. What shortens life is not the diagnosis itself, it's ignoring the signs or delaying treatment. With the right habits, knowledge, and support, heart disease can become just one part of your story, not the end of it. Let's keep going with more important and practical questions people often ask about daily habits and how they affect the heart. One thoughtful question is this: is skipping breakfast bad for the heart? Surprisingly, yes. Regularly skipping breakfast has been linked to a higher risk of heart disease. When you skip breakfast, your body can experience more insulin resistance, increased blood pressure, and higher cholesterol levels over time. It may also lead to overeating later in the day, which puts strain on your metabolism and your heart. A balanced breakfast, something simple like oats, fruit, or a boiled egg with whole grain toast, can help stabilize energy and reduce cardiac stress. Think of it as giving your heart a calm, steady start instead of forcing it to catch up later. Now another common one. Does eating too much salt always lead to high blood pressure? Salt is one of the biggest contributors to high blood pressure, but the effect can vary from person to person. Some people are more salt sensitive, meaning their blood pressure reacts strongly to even a small increase. For others, it builds slowly over time. The challenge is that salt is hidden in packaged foods, snacks, pickles, and even bread. Even if you don't feel it today, the long-term impact can quietly damage your arteries. Cutting back, not eliminating the salt, and reading labels carefully can make a real difference. You won't notice the change immediately, but your heart will. And here's one that people often ask with guilt or uncertainty. If I've eaten unhealthy food most of my life, is it too late to start taking care of my heart now? Absolutely not. It's never too late to change. The human body is incredibly resilient. Even small changes made today can begin to heal damage that's been years in the making. Your arteries can become more flexible, your blood pressure can stabilize, and your risk of a heart attack can drop, even after decades of bad habits. The key is to start small and stay consistent. Every better choice you make, every walk, every home-cooked meal, every moment of rest, sends a message to your heart. I'm still taking care of you. One that comes up often is, can walking be just as effective as jogging or gym workouts for the heart? Yes. For many people, walking is one of the best forms of exercise for heart health. It's low impact, gentle on the joints, and still gets the blood flowing, improves circulation, and strengthens the heart muscle. What matters most is consistency. Walking briskly for 30 minutes a day, 5 days a week, is enough to reduce your risk of heart disease. You don't need a gym, a treadmill, or fancy equipment. Just a good pair of shoes and a safe place to move. Jogging has its benefits too, but for older adults or those with joint concerns, walking is often safer and more sustainable. Another concern that often follows is, what's better for the heart? Losing weight quickly or losing it slowly over time? Losing weight slowly and steadily is far better for your heart than fast extreme diets. Rapid weight loss often leads to muscle loss, dehydration, and strain on the liver and kidneys, all of which can increase cardiovascular risk. When weight is lost gradually, around 1 to 2 pounds a week, your body has time to adjust, and your metabolism stays healthier. Even modest weight loss, like 5 to 10% of your body weight, can significantly improve blood pressure, cholesterol, and blood sugar levels. Think of it as healing from the inside, not just shrinking from the outside. And here's one that touches on emotional well-being, too. Does loneliness or social isolation affect heart health? Yes, and more than most people realize. Loneliness isn't just an emotional experience, it's a physical stressor. Studies have shown that people who feel socially isolated have higher levels of inflammation, increased blood pressure, and a greater risk of heart disease. The heart is not just a pump. It's deeply connected to how we feel and how we connect with others. Staying socially active, even through small daily conversations or community activities, is a powerful act of self-care for your heart. One important question I'm often asked is, if I start taking heart medicine, do I have to stay on it forever? Not always, but often, yes. Many heart medications, like those for high blood pressure or cholesterol, are meant to be taken long-term, sometimes for life. But that's not a punishment. It's protection. These medications don't cure the problem, but they help control it, keeping your blood pressure stable, your heart rhythm regular, and your arteries clear. That said, if your condition improves dramatically through lifestyle changes, your doctor might lower the dose or even stop some medications over time. But this decision must always be made carefully, with monitoring, never on your own. A related concern that comes up is, I feel fine now. Do I really need to keep taking my heart pills if I have no symptoms? This is a common mistake. Feeling fine doesn't mean the problem is gone. It usually means the medication is working. High blood pressure, high cholesterol, or early-stage heart disease often have no symptoms at all. That's why they're called silent killers. Stopping your medicine just because you feel okay is like stopping an umbrella in the rain because you haven't gotten wet yet. Your health might seem steady, but behind the scenes, stopping your meds could reverse the progress you've made. And here's a concern especially relevant to older adults. I'm taking many medicines now. How do I know they're not harming my heart or interacting with each other? This is a wise and important question. As we age, polypharmacy, taking multiple medications, becomes more common, and the risk of side effects or interactions increases. Some drugs can affect the heart's rhythm, raise blood pressure, or interact dangerously with heart medications. That's why it's vital to have all your prescriptions reviewed regularly by your doctor or pharmacist. Keep a full list of everything you take, including over-the-counter supplements and herbal remedies. Even something natural can interfere with heart medications. Transparency and regular check-ins are the safest way to protect your heart when managing multiple conditions. Let's shift our focus to diet, one of the most talked about topics when it comes to heart health. People often have many questions and myths swirling around what to eat and what to avoid. A very common question is eating fat really bad for the heart, or are some fats good? This is a great question, and the answer is nuanced. Not all fats are created equal. Saturated fats and trans fats, often found in fried foods, processed snacks, and fatty cuts of meat, can raise bad cholesterol levels and increase heart disease risk. However, unsaturated fats, like those found in olive oil, avocados, nuts, and fatty fish, are actually heart-friendly. They help reduce inflammation and improve cholesterol balance. The key is to replace unhealthy fats with healthy ones, rather than cutting out all fats altogether. Balance and quality matter more than zero fat. Another question many people ask is, how important is salt reduction, and how can I realistically cut back? Salt is indeed a major contributor to high blood pressure, which stresses the heart. Cutting back on salt doesn't mean your food has to be bland. Use herbs, spices, lemon juice, and garlic to add flavor instead. Check food labels carefully because most of the salt we consume comes hidden in processed foods, breads, and sauces. Gradual reduction is better than sudden change, so your taste buds can adjust. Over time, you'll find less salty food just as satisfying, and your heart will thank you. Finally, a question that often puzzles people is, can drinking green tea or other herbal teas improve heart health? Green tea has antioxidants that may support heart health by reducing inflammation and helping blood vessels function better. Some herbal teas, like hibiscus and ginger, have also shown benefits for blood pressure and circulation. That said, teas are a supplement to a healthy lifestyle. They're not a magic cure. Drinking a cup or two a day can be a pleasant and helpful habit, but it should never replace medications or doctor advice. Always discuss herbal supplements with your healthcare provider to avoid interactions. Now, let's explore some questions about physical activity and how it specifically benefits the heart, especially for those starting new habits or dealing with existing conditions. One frequent question is it safe to exercise if I have heart disease, or could I make it worse? In most cases, yes. Exercising with heart disease is not only safe, but highly recommended. Physical activity strengthens the heart muscle, improves circulation, lowers blood pressure, and helps control weight. Of course, the type and intensity of exercise should be tailored to your individual condition, age, and fitness level. It's important to start slowly, listen to your body, and consult your doctor before beginning any new routine. Many cardiac rehabilitation programs provide supervised exercise that is both safe and effective for heart patients. Another question is, what are some simple exercises I can do at home to help my heart? Walking is one of the simplest and most effective exercises. Gentle stretching, chair yoga, and light resistance training with bands can also improve circulation and muscle strength without overexertion. Breathing exercises and mindfulness can reduce stress and improve heart rate variability, which is good for cardiovascular health. Consistency is more important than intensity. Regular, moderate movement every day supports your heart far better than occasional intense workouts. Finally, many people ask, how do I know if I'm exercising too much or pushing my heart too hard? Pay attention to warning signs like chest pain, excessive shortness of breath, dizziness, or palpitations during or after exercise. If you experience any of these, stop immediately and seek medical advice. It's normal to feel some fatigue or mild muscle soreness, but the heart shouldn't feel overwhelmed. Using tools like a pulse monitor or simply checking your perceived exertion can help you stay in a safe zone. When in doubt, slower and steadier wins the race. One question that many people quietly wonder about is, how does high cholesterol really affect the heart? And what can I do if my cholesterol levels are high? High cholesterol is a silent, yet significant risk factor for heart disease, often unnoticed because it rarely causes symptoms on its own. To understand how cholesterol affects your heart, it helps to know that cholesterol is a type of fat essential for many bodily functions. Your body uses cholesterol to build cells, produce hormones, and help digest foods. However, cholesterol travels through your bloodstream attached to proteins, forming lipoproteins. The two main types are low-density lipoprotein, LDL, often called bad cholesterol, and high-density lipoprotein, HDL, known as good cholesterol. The trouble begins when your LDL cholesterol levels become too high. LDL can deposit cholesterol on the walls of your arteries, forming thick, sticky plaques. These plaques narrow the arteries, reducing blood flow, a condition called atherosclerosis. When your arteries are narrowed, your heart muscle may not receive enough oxygen-rich blood, especially during times of increased activity. This can cause chest pain or angina. More dangerously, plaques can rupture suddenly. When this happens, your body tries to repair the damage by forming a blood clot at the site. If the clot blocks the artery entirely, it can cause a heart attack, which damages or kills part of the heart muscle. This process usually happens silently over years, which is why cholesterol is often called a silent killer. But the good news is that high cholesterol can be managed effectively. The first step is lifestyle changes. Diet plays a crucial role. Choosing foods low in saturated and trans fats while rich in fiber, fruits, vegetables, and healthy fats can lower LDL cholesterol. For example, swapping butter for olive oil, eating fatty fish like salmon, and adding nuts and seeds can boost your heart health. Physical activity also helps by raising HDL cholesterol, the good kind, which helps remove LDL cholesterol from your bloodstream. Regular exercise, such as brisk walking for at least 30 minutes most days of the week, is a simple yet powerful tool for controlling cholesterol levels. If lifestyle changes alone aren't enough, your doctor may prescribe medications such as statins, which reduce the production of cholesterol in your liver. Statins have been proven to lower the risk of heart attacks and strokes significantly. Other medications can help too, depending on your specific condition. Monitoring your cholesterol levels regularly is vital. Your doctor will use blood tests to track your LDL, HDL, total cholesterol, and triglycerides, another type of fat linked to heart disease. Depending on your overall risk factors, such as age, family history, smoking, and diabetes, your doctor will tailor your treatment plan. A question that often worries many is, what exactly is high blood pressure and why is it such a big concern for heart health? High blood pressure, also called hypertension, is often called the silent killer because it usually has no symptoms until serious damage has already occurred. To understand why it's so dangerous, let's first look at what blood pressure actually is. It's the force exerted by your blood pushing against the walls of your arteries as your heart pumps. Imagine your arteries as flexible pipes. If the pressure inside them is too high for a long time, they start to weaken and become less elastic. When blood pressure stays elevated over months or years, it forces your heart to work harder to pump blood, which can lead to thickening of the heart muscle. Over time, this extra strain may cause the heart to enlarge and eventually weaken, reducing its ability to pump blood efficiently. This condition is known as hypertensive heart disease. High blood pressure also damages the lining of your arteries, making it easier for cholesterol and other fatty deposits to build up, accelerating the development of atherosclerosis, the narrowing and hardening of arteries. Narrow arteries reduce blood flow to the heart and other vital organs, increasing the risk of heart attacks, strokes, kidney damage, and even vision loss. One of the reasons hypertension is so tricky is that it usually doesn't cause symptoms like pain or discomfort. Many people only find out they have high blood pressure during routine medical checks or after a serious event like a heart attack. This silent nature is why regular monitoring is so crucial, especially for people over 40 or those with risk factors such as family history, obesity, diabetes, or smoking. Managing high blood pressure involves lifestyle changes and, when necessary, medication. Reducing salt intake, maintaining a healthy weight, exercising regularly, managing stress, and limiting alcohol are foundational steps. Foods rich in potassium, like bananas and leafy greens, can help balance blood pressure as well. Medications can include diuretics, ACE inhibitors, beta blockers, and calcium channel blockers, each working differently to lower blood pressure and protect the heart. Your doctor will choose the right combination based on your health profile. Controlling high blood pressure is one of the most effective ways to reduce your risk of heart disease and stroke. With careful management and regular follow-up, many people live full, healthy lives despite having hypertension. Remember, even if you feel fine, high blood pressure can be silently causing damage. Taking it seriously and following your healthcare provider's advice can save your life. A question I often encounter is, what role does diabetes play in heart disease, and how can people with diabetes protect their hearts? Diabetes is one of the most significant risk factors for heart disease. When blood sugar levels remain high over time, it can cause damage to blood vessels throughout the body, including those supplying the heart. This damage accelerates the process of atherosclerosis, making arteries narrower and less flexible, which increases the risk of heart attacks and strokes. People with diabetes often have other conditions that raise heart risk, such as high blood pressure, high cholesterol, and obesity. This combination can multiply the dangers, making heart disease the leading cause of death among individuals with diabetes worldwide. High blood sugar can also make the blood thicker and more prone to clotting, increasing the chance of blockages in coronary arteries. Additionally, diabetes may impair the heart's ability to pump effectively, leading to a condition known as diabetic cardiomyopathy, which can cause heart failure even in the absence of artery blockages. Protecting your heart when you have diabetes involves a comprehensive approach. The cornerstone is controlling blood sugar levels through a balanced diet, regular exercise, and medication when necessary. Keeping blood sugar within the target range reduces the stress on your blood vessels and lowers the risk of complications. Equally important is managing other risk factors like blood pressure and cholesterol. Many people with diabetes need medications such as statins or blood pressure drugs alongside their diabetes treatment. Regular checkups and tests help monitor these levels and allow timely adjustments to therapy. Lifestyle changes make a huge difference. Eating a heart-healthy diet rich in vegetables, whole grains, lean proteins, and healthy fats supports both diabetes and heart health. Avoiding processed foods and sugary drinks helps keep blood sugar stable and reduces inflammation. Physical activity improves insulin sensitivity, meaning your body can use sugar more efficiently, and it strengthens your heart muscle. Even moderate activities like walking, swimming, or cycling for 30 minutes most days can have profound benefits. Stress management is another often overlooked but critical factor. Chronic stress can worsen blood sugar control and increase heart risk. Techniques like mindfulness, meditation, and social support are valuable tools. Lastly, never skip your medications or routine medical visits. Diabetes and heart disease are serious conditions that require ongoing care and partnership with your healthcare team. With the right approach, people living with diabetes can lead healthy, active lives and significantly reduce their risk of heart disease. Knowledge, vigilance, and consistent effort are your best defenses. How does smoking affect the heart, and can quitting really reverse the damage? Smoking is one of the most harmful habits for your heart and blood vessels. The chemicals in tobacco smoke damage the lining of your arteries, causing inflammation and promoting the buildup of fatty plaques, a process known as atherosclerosis. This narrowing of the arteries reduces blood flow to the heart and can lead to chest pain, heart attacks, and even sudden cardiac death. Nicotine, a powerful stimulant found in cigarettes, raises your heart rate and blood pressure immediately after you smoke. It also makes your blood more likely to clot, which can block blood flow in narrowed arteries. Carbon monoxide from smoke reduces the oxygen-carrying capacity of your blood, making your heart work harder to supply oxygen to your tissues. Over time, smoking accelerates the development of coronary artery disease, increases the risk of peripheral artery disease, and can cause irregular heart rhythms. The risk is dose-dependent. The more you smoke and the longer you continue, the greater the damage. However, quitting smoking can rapidly and dramatically improve your heart health. Within 24 hours of quitting, your blood pressure and heart rate begin to drop to healthier levels. Within a few weeks, circulation improves and lung function starts to recover. After 1 year, your risk of coronary heart disease drops by about half compared to a smoker. Long-term, quitting smoking can add years to your life and reduce your risk of heart attack, stroke, and other cardiovascular complications. Even if you've smoked for many years, it's never too late to quit. The benefits begin immediately and continue to grow with time. Support is important in quitting smoking, whether through counseling, medications, or support groups. Many people find it helpful to combine methods for the best success. Remember, quitting is a process that takes time and patience. Your heart, lungs, and whole body will thank you for every day without smoking. It's one of the most powerful steps you can take to protect your health and improve your quality of life. A question that many people wonder about is, what is heart failure, and does it mean the heart has stopped working? Heart failure is a condition where the heart is no longer able to pump blood as effectively as it should. It doesn't mean the heart has stopped. Rather, it means the heart's pumping power is weaker, and it can't meet the body's demands as well as before. This can lead to symptoms like shortness of breath, fatigue, swelling in the legs or abdomen, and difficulty exercising. Heart failure can result from many causes, including previous heart attacks, long-standing high blood pressure, valve problems, or diseases that directly affect the heart muscle. It's a chronic condition, but with proper management, people with heart failure can live long and active lives. Managing heart failure involves medications that help the heart pump more efficiently, reduce fluid buildup, and control blood pressure. Lifestyle changes like reducing salt intake, monitoring weight daily, and avoiding excessive fluid intake are also crucial. Regular checkups help monitor symptoms and adjust treatment. Importantly, heart failure is not a sudden stop, but a condition that often develops slowly. Early diagnosis and treatment can greatly improve quality of life and slow progression. Many new treatments and devices are available that help people with heart failure live better and longer. Living with heart failure means working closely with your healthcare team, understanding your symptoms, and making heart-healthy choices every day. It's a journey, but one with hope, care, and many options for support. A question that comes up often is, what are the warning signs of a heart attack, and how quickly should I act if I notice them? Recognizing the warning signs of a heart attack can be life-saving. A heart attack happens when blood flow to a part of the heart muscle is blocked, often due to a clot forming on a ruptured plaque inside an artery. The sooner treatment begins, the better the chance of saving heart muscle and preventing complications. Classic symptoms include chest discomfort or pain, often described as pressure, squeezing, fullness, or heaviness, usually in the center or left side of the chest. This discomfort may last for several minutes or come and go. It can also spread to the arms, neck, jaw, back, or stomach. However, not everyone experiences these classic symptoms. Some people, especially women, seniors, and those with diabetes, may have atypical signs such as shortness of breath, nausea, vomiting, lightheadedness, or unusual fatigue. Sometimes, symptoms can be mild and mistaken for indigestion or muscle strain. It's important to take any sudden or unexplained chest discomfort seriously, especially if accompanied by sweating, nausea, or weakness. If you suspect a heart attack, call emergency services immediately. Do not try to drive yourself to the hospital. Time is muscle. The longer the heart muscle goes without oxygen, the more damage occurs. Emergency treatments like clot-busting drugs or angioplasty can restore blood flow and save your heart. Knowing the warning signs and acting quickly can make the difference between life and death. Share this knowledge with family and friends. It could save a life one day. An important question many people ask is, what exactly is atrial fibrillation, and why does it increase the risk of stroke? Atrial fibrillation, often called AFib, is a common heart rhythm disorder where the heart's upper chambers, the atria, beat irregularly and often rapidly. Instead of the usual coordinated contraction, the atria quiver or fibrillate. This irregular rhythm can cause blood to pool in the atria, increasing the chance that blood clots will form. If a clot breaks loose, it can travel through the bloodstream to the brain, causing a stroke. That's why AFib significantly increases stroke risk, up to 5 times higher than in people without it. AFib may cause symptoms such as palpitations, shortness of breath, fatigue, or chest discomfort, but some people have no symptoms at all and only find out during routine checks. Managing AFib focuses on 2 goals: controlling the heart rate and preventing stroke. Rate control can be achieved with medications that help the heart beat more regularly and comfortably. Stroke prevention often requires blood-thinning medications, known as anticoagulants, which reduce the chance of clot formation. Lifestyle changes, such as reducing alcohol and caffeine intake, managing stress, and treating underlying conditions like high blood pressure or sleep apnea, can also help reduce AFib episodes. Regular monitoring and communication with your healthcare provider are key to safely managing AFib and minimizing complications. With proper care, many people with AFib live full, active lives while keeping their stroke risk low. I want to invite everyone watching live right now to send in your questions about heart health in the chat. This is your chance to get personalized answers and clear up any doubts you might have. For those watching this after the live session, don't hesitate to leave your questions in the comments below. I'll be checking and responding as soon as possible because your health matters. If you've found this discussion helpful so far, please consider subscribing to the channel and turning on notifications. That way, you won't miss any of our upcoming live sessions or new videos packed with valuable health information. Your support helps us keep sharing important content that can make a real difference in your life and the lives of others. Stay tuned, stay healthy, and keep those questions coming. A question many people have is, how does sleep affect heart health, and what can I do if I struggle with poor sleep? Sleep plays a crucial role in maintaining a healthy heart. During sleep, your body repairs blood vessels, regulates hormones, and lowers blood pressure and heart rate, giving your cardiovascular system a chance to rest. Poor sleep quality or insufficient sleep disrupts these processes and can increase the risk of high blood pressure, obesity, diabetes, and heart disease. Sleep disorders like sleep apnea are especially concerning. In sleep apnea, breathing stops temporarily multiple times during the night, causing oxygen levels to drop and blood pressure to spike repeatedly. This puts tremendous strain on the heart and increases the risk of arrhythmias, heart attacks, and stroke. If you struggle with poor sleep, start with good sleep hygiene. Keep a consistent bedtime, create a calm and dark environment, avoid caffeine and heavy meals close to bedtime, and limit screen time before sleep. If you snore loudly, wake up gasping, or feel excessively tired during the day, consult a healthcare provider. You might need testing for sleep apnea or other conditions. Addressing sleep problems not only improves how you feel during the day, but also provides long-term protection for your heart. Good sleep is a powerful, natural medicine for cardiovascular health. One last question many people ask is, how does stress affect the heart, and what are effective ways to manage it? Stress is often overlooked but plays a significant role in heart health. When you're stressed, your body releases hormones like adrenaline and cortisol, which prepare you for a fight-or-flight response. These hormones raise your heart rate and blood pressure temporarily, which is helpful in short bursts, but harmful when stress is chronic. Chronic stress can lead to sustained high blood pressure, inflammation, and unhealthy behaviors such as poor diet, smoking, and physical inactivity, all major contributors to heart disease. Stress can also trigger irregular heart rhythms and increase the risk of heart attacks. Managing stress effectively requires a combination of strategies. Mindfulness meditation, deep breathing exercises, and yoga can help calm the nervous system and reduce blood pressure. Regular physical activity releases endorphins, natural mood elevators that also benefit your heart. Social connections and talking about your feelings with friends, family, or professionals provide emotional support and help reduce stress. Setting realistic goals, taking breaks, and practicing hobbies you enjoy are also important. Remember, stress is a normal part of life, but how you handle it can make all the difference. By taking active steps to manage stress, you protect not just your heart, but your overall well-being. Thank you so much for spending this time with us today, diving deep into some of the most important questions about heart health. Your heart is the engine that keeps you going, and understanding how to protect it is truly a lifelong journey. Remember, heart health isn't just about avoiding disease. It's about embracing a lifestyle that supports your body, mind, and spirit. Whether it's through the food you eat, the way you move, the sleep you get, or how you manage stress, every positive choice you make adds up to stronger, healthier years ahead. If there was something you learned today that surprised you, or if you have lingering questions, don't hesitate to take action. Talk to your doctor, make small adjustments, or reach out here anytime. Your health is worth the effort. If you enjoyed this session, please show your support by liking the video, sharing it with your friends and family, and subscribing to the channel. That way, you'll stay connected to more helpful content designed to empower you in your wellness journey. Don't forget to turn on notifications so you won't miss any of our upcoming live talks or new videos. And for those watching after the live, please leave your questions or comments below. I read every message and will do my best to respond. Your engagement helps us grow this community and reach even more people who want to live healthier lives. Thank you again for being here, for caring about your heart, and for taking these important steps toward a vibrant, fulfilling life. Take good care of yourself, stay mindful, and I look forward to seeing you in the next video or live session. Until then, be well, be kind to your heart, and stay healthy.